Hi, my name is Janelle Friesen. I'm the Public Information Officer at the UG Public Health Department, and I'm here with Ashley today to talk about our WIC program and what our WIC services look like in the midst of the COVID-19 pandemic. Ashley, would you like to introduce yourself?
Yes, hello. Um, so my name is Ashley Laws. I am a registered dietitian for the Wyandotte County WIC program. I am the WIC manager, and I have been with the health department or working in WIC for the health department for 8 years now. I absolutely love it. It's been such a wonderful experience working with our Wyandotte County families.
So can you tell me about what WIC has been doing to provide services in the midst of COVID-19?
So, all of our services are available remotely by phone. This has been able to help people get services that they need, but also limit the spread of COVID. Normally, our appointments are in person, but we have a waiver at the national level that's in place that's allowing us to do these services over the phone. This waiver currently coincides with the public health state of emergency date. So right now that is January 21st that state of emergency goes through. If they do not renew that in January, then we have 30 days to reopen. And that would mean that our soonest to reopen would be February of 2021.
So what services does WIC provide?
So we provide nutrition education, which is done by registered dietitians. We provide breastfeeding support through our breastfeeding peer counselors, and also our dietitians can do some support as well. We provide healthy foods to families via a WIC food package. We also do referrals to other health and social services around the county.
And are all of those services available remotely?
Yes, so the dietitians can do counseling over the phone and provide that breastfeeding support over the phone. We also our WIC benefits are provided via an eWIC card. So that card, if it's a new client, that card gets mailed out to the client and with instructions telling them how to activate the card. And then after that, we can just add benefits remotely or electronically from there on out.
All right, great. So who's eligible for remote services?
So anybody who is on WIC, currently on WIC, or is new to WIC would be eligible for remote services. The people that are eligible for WIC would be those that are low income families, um, moms who are pregnant, breastfeeding their baby up to the baby's first birthday, or those that aren't breastfeeding can get WIC until 6 months after the baby's born. Also, we serve infants and then children up until their fifth birthday.
All right, so another thing about accessing your services, in light of the public charge rule, community members who are immigrants might be worried about accessing certain services. What does that mean for WIC services?
Well, WIC is not included in the public charge rule and will not trigger a public charge test. So using WIC benefits will not affect immigration status for people currently in the US. It is safe to use WIC, and we really encourage those that are eligible for WIC benefits to please reach out to us because we know that we can help those families.
So how do WIC remote services work?
So the first thing they'll do is they'll call the WIC office and they'll set up an appointment. The person setting up the appointment will give them instructions telling them that there's a window of time the day of their appointment that they're going to get a call. And they will also get a reminder call and a text reminder the day before their appointment, just giving them, letting them know what to expect during the appointment. On the day of the appointment, the staff will call. If the client doesn't pick up, then we will leave a message or we will continue to try to call them at random parts throughout the rest of the day. If the call is completely missed, the client, it can reach out to us and call us on our main number, which is 913-573-6377. 6720. The staff person who manages the line can transfer the client to the person who's supposed to do the appointment for them, or kind of reschedule them if need be for a different day.
All right. So how can someone set up a remote WIC appointment?
They just need to call the office. They can call at 913-573-6720. The staff person, a staff person mans that phone line Monday through Friday, 8:30 to 4 p.m. So they can call us anytime during that day and we can make them an appointment. They also can email us at nutrition@wicokck.org to request an appointment, and then a staff person would reach out to them as well and make that appointment for
All right, great. Well, thank you so much for talking to me today about our WIC services and what those look like in the midst of COVID-19. I just want to remind everyone that they can set up their remote WIC appointment by calling 913-573-6720. And you could also email nutrition@wicokck.org. And if you want to learn anything else about COVID-19 in Wyandotte County, go to wicokck.org/COVID-19. Thank you.
Thank you.